Today in this class we'll demonstrate the kidney and ureter. Kidneys are a pair of reddish-brown, bean-shaped, retroperitoneal excretory structures present in the posterior abdominal wall, occupying the epigastric, hypochondriac, lumbar, and the umbilical regions. Vertically, it extends from T12 to L3 vertebra. The right kidney lies slightly lower than the left kidney because of the presence of liver on the right side. The transpyloric plane passes through the upper part of the hilus of the right kidney and through the lower part of the hilus of the left kidney. Each kidney is about 11 centimeter long, 6 centimeter broad, and 3 centimeter thick. It is about 1 by 150 grams in males and 130 grams in females. Here you can see the right kidney and the left kidney present in the posterior abdominal wall on either side of the vertebral column. Here you can see the right kidney, this one, lies lower than the left kidney, which lies at a little higher level. On the right side, the right kidney is lower because of the presence of the liver. Here you can see it is bean-shaped, reddish brown structure having an upper pole and lower pole, a anterior surface and a posterior surface, and a outer convex border. And here the inner border, where you can see middle border concave, and it has got an indentation here, that is the hilum, through which you can see the renal artery and the renal vein they enter, and the renal pelvis here, it also passes. Relation being the artery, vein, and nerve and pelvis. So from before backwards, the relations are artery, vein, and renal pelvis. Here you can see the inferior vena cava on the right side, and on the left side is the abdominal aorta. Here what you can see is the ureter, which is a continuation of the renal pelvis at the lower border, at the lower pole of the kidney. Now, here what you can see is the celiac trunk. This is the suprarenal gland. The right one is triangular pyramidal shape, and the left suprarenal gland, here you can see it is semilunar in shape. Here what you can see is the first lumbar nerve present. Here it is the this muscle is the psoas major. This is the quadratus lumborum. The psoas major is present medially, and quadratus lumborum is present laterally. And on its anterior surface, you can see the first lumbar nerve here. This is the right dome of the diaphragm. Here is the left dome of diaphragm. Coverings of the kidney. The coverings of the kidney consist of the fibrous capsule. This is a thin membrane which closely invests the kidney and lines the renal sinus. The second covering that lies outside the fibrous capsule is the perirenal or perinephric fat. So this is the adipose tissue lying outside the fibrous capsule. It is thickest at the borders of the kidney, and this adipose tissue fills up the extra space in the renal sinus. Then comes the renal fascia. So renal fascia is made up of two layers, a anterior and a posterior. The two layers, anterior and posterior layers, they fuse laterally to form lateral conal fascia and blends with the parietal peritoneum behind the colon. It extends anteromedially behind the kidney as bilaminated sheath. Superiorly, the renal fascia encloses the suprarenal gland and fuses with the diaphragmatic fascia. The suprarenal gland lies in a separate compartment. Below the anterior and posterior layers, they extend along the ureter and fuse with the iliac fascia. Then comes the pararenal or the paranephric fat. It consists of varying amount of fat lying outside the renal fascia. This fat is more abundant posteriorly and towards the lower pole of the kidney. It fills up the paravertebral cutter and forms a cushion for the kidney. So, if this pararenal fat is deficient, the kidney may become mobile. The suprarenal gland is present in a separate compartment of the renal fascia at the superior pole of the kidney. In this transverse section of the abdomen, taken at the level of the L2 vertebra, you can see the two bean-shaped kidneys are present on either side of the vertebral column in the paravertebral cutter. So this is what you can see is the paravertebral cutter in the posterior abdominal wall where you find the kidney. And this kidney here you can see in this transverse section, you can see this is the fibrous capsule. Then outer fibrous capsule there is a perinephric fat. Then this is the renal fascia. Here. You can see the renal fascia. This is laterally continuous with the parietal peritoneum, and here you can see medially it extends uh, across the vertebral column. Here what you can see anteriorly is the aorta. So anterior to the body of the vertebra you find aorta on the left side and inferior vena cava on the right side. Here you can see the renal vein entering into the left, renal vein entering into the right kidney. The external features of the kidney are it is a bean-shaped structure having a broad upper pole related to the suprarenal gland and a pointed lower pole. The, it has two surfaces. The anterior surface is irregular and the posterior surface is flat. So this is irregular because of the presence of the various abdominal viscera which are related anteriorly. The, it has got two borders, a lateral border and a medial border. Lateral border is convex, the medial border is concave, and it has got a hilum in the middle. Hilum gives passage from anterior to posterior, the renal vein, renal artery, and renal pelvis. At the lower pole of the kidney, the renal pelvis becomes continuous as ureter. Here you can see the right kidney. His right kidney has got a upper pole which is border, a lower pole It is inferior pole. Here you can see the outer convex border. This is outer, the lateral border, which is convex. This is the concave. The middle border, it is concave, having an indentation, that is the hilum. And through the hilum, you can see there passes the renal artery anteriorly, vision vein posteriorly, in the middle, and renal pelvis posterior. The relation from before backwards is the renal artery, the vein, and renal pelvis. This renal pelvis descends down, and at the lower pole it becomes continuous as ureter. Here you can see an aberrant artery, that is the polar artery, entering near the superior pole. In the coronal section, kidney shows a outer reddish brown cortex having 10 conical masses. These conical masses are called renal pyramids. The apexes of these pyramids form renal papillae, which indent the minor calyxes. The renal cortex is divided into outer cortical arch or the cortical lobule, which forms cap over the bases of the pyramids. Renal columns which dip in the between the pyramids. Each pyramid, along with the overlying cortical arch, forms what is known as lobule of the kidney. The inner medulla is pale. There is a space known as renal sinus, which extends into the kidney from the height. It extends from before backwards. It contains from before backwards the branches of renal artery, tributaries of renal vein, and renal pelvis. The pelvis divides into 2 to 3 major calyxes, which in turn divides into 7 to 13 minor calyxes. Here you can see the coronal section of the kidney. You can see here the outer reddish area, that is the cortex, and an inner pale area, that is known as the medulla. Now, this cortex here you can see has got these pyramidal structures. The base is directed outwards and apex is directed medially. On the base of the cortex, there lies the cortical arches. The pyramid with a cortical arch forms a renal lobule. Now, here you can see the renal pelvis. It divides into major calyxes. Each major calyxes, there are 2 to 3 major calyxes. Each major calyx divides into minor calyx, some 3 to 4 minor calyxes. Here, these you can see the minor calyxes. So, in between the pyramids, you can see the renal column where indents. So, this where indents the minor calyxes. Here you can see near the lower pole, the pelvis becomes continuous with the ureter, and this pelvic ureteric junction is one of the narrow points. It is one of the constructions in the ureter. relations of the kidney. The relations common to both the kidney are at the upper pole you find the corresponding suprarenal gland. On the middle border you see the suprarenal gland lies above the hilus and ureter lies below the hilus. On the posterior surface, kidney is related to the diaphragm, medial and lateral arcuate ligaments, psoas major, quadratus lumborum, transversus abdominis, subcostal vessels, and subcostal iliohypogastric and ilioinguinal nerves. The right kidney is related to the 12th rib, and the left kidney is related to 11th and the 12th ribs. And these relations are very important while exposing the kidney from posterior, which is the usual approach for the kidney. The other relations of the kidney are the right kidney is anteriorly related to the right suprarenal gland, liver, second part duodenum, hepatic flexure of the colon, and a small intestine. The hepatic and the intestinal surfaces are covered with the peritoneum. The lateral border is related to the right lobe of the liver and hepatic flexure of the colon. So here you must appreciate the kidney is retroperitoneal and anteriorly the hepatic and intestinal surfaces are covered with the peritoneum, while the posterior surfaces they are not covered by peritoneum. The left kidney is anteriorly related to the left suprarenal gland, the spleen, the stomach, pancreas, the splenic vessels, the splenic flexure of colon, the descending colon, and jejunum. The gastric, splenic, and jejunal surfaces they are covered with the peritoneum. The lateral border is related to the spleen and descending colon. Here you can see the right kidney is C2. You can see the relations. Here this is what you can see. The right kidney. This is outer covering is the of the fibrous capsule. Then this you can see the perirenal fat, this layer, and here this you can see is the renal fascia. And here you can see the suprarenal gland lies in a separate compartment. Superiorly, the renal fascia fuses with the diaphragmatic fascia. Laterally, here you can see the renal fascia is continuous with the parietal peritoneum. Here you can see the paravertebral gutter is pararenal fat. This muscle here, it is the psoas major, and posterior to this you can find here, and lateral to this you can find is the quadratus lumborum. Here in the hilum you can see the renal arteries, and this is the renal vein. This is what you can see is the inferior vena cava. The vascular segments of the kidney. The renal artery divides into a anterior and a posterior division. The anterior division gives four segmental branches, while posterior division gives one segmental branch. So that's how there are five segmental branches of the renal artery, which form the vascular segments of the kidney. So on the anterior aspect you find the apical, both the upper, middle and the lower segments, and on the posterior aspect you see the posterior segment, and parts of the apical and lower segment. Here you can see the abdominal aorta. This is the renal artery, and here you can see the renal artery right side is larger than the left because this renal artery has to cross in front of the inferior vena cava. This is the inferior vena cava. This is the gonadal artery you can see emerging from the abdominal aorta. Here, what you can see is the suprarenal gland on the right side, and this is this left suprarenal gland. Here you can see the left suprarenal vein, and this is what you can see the psoas major. This is the quadratus lumborum. This is what you can see the superior mesenteric artery arising from the front of the abdominal aorta. Here this diagram shows the vascular segments of the kidney. Here in the anterior surface you can see the apical segmental artery. This is, you can see the anterior superior segmental artery. This is the anterior inferior segmental artery, and here you can see the inferior segmental artery. So four segments: apical, uh, upper segmental. This is the lower segmental, that is the superior segmental, and inferior anterior inferior segmental artery. And this is the inferior segment. Here, this is the posterior surface of the kidney, and you can see the posterior segment artery. This is the posterior segment, and here what you can see is the apical, and here is the part you can see the inferior segment. This is the kidney. You can visualize ultrasonographically. So this is ultrasonographic visualization of the kidney. Here you can see the kidney. You can measure its length and its breadth. You can see here the kidney is divided into the outer cortex. Here this is the cortex, and this is the inner medulla. And here this is the renal pelvis. This kidney can also be visualized by intravenous pylography. On intravenous pylogram, you can see is the right kidney line lower, this is the left kidney line at a higher level. You can see is the renal pelvis, which divides into major calyxes, and these major calyxes divide into minor calyxes. Here you can see the renal pelvis, the major calyxes, the minor calyxes. And here you can appreciate the minor calyxes. In the apex of the minor calyxes, they are cup shaped. This is what you can see is the ureter running at the tips of the transverse courses of the lumbar body. And because of the peristaltic waves, here the middle segments are not visualized. Here you can see the lower segment will not visualize on the right side. On the left side, you can see the lower segment of the ureter, and this is what you can see is the urinary bladder present in the true pelvis. The ureter is a thick walled muscular tube about 25 centimeter in length, 3 millimeters in diameter. It begins at the lower pole of the kidney as continuation of the renal pelvis. This ureter passes downwards and medially on the tips of the transverse processes and psoas major muscle, and it enters the pelvis by passing in front of the termination of the common iliac artery. In true pelvis, it runs downwards following anterior margin of the greater sciatic notch opposite the ischial spine. The ureter turns forwards and medially to reach the base of the urinary bladder. Nearly upper half of the ureter lies in the abdomen, while the lower part of the ureter, lower half, lies in the pelvis, true pelvis. There are five constrictions in ureter, and these constrictions, they are very important if there is a passage of stone through the ureter. So these are the places, these constrictions are places where a stone may get held up leading to the ureteric colic or the renal colic. The sites of the constriction are number one at the pelvic ureteric junction, number two at the brim of the lesser pelvis, number three at crossing of the ureter by ductus deferens or the broad ligament of uterus. Number 4, at its oblique passage through the wall of the urinary bladder. And fifth is the opening in the lateral angle of the triangle. So these are the sites where the ureteric stone may get held up, leading to the renal colic and obstructive uropathy. The blood supply of the ureter consists of, in the upper part, it is by the renal artery mainly, also gets some blood supply from the gonadal and colic artery. The middle part of the ureter is supplied by aorta and also by some of the gonadal and iliac branches. So some supply also is derived from gonadal and iliac artery. The lower part of the ureter is supplied by the vesical artery, middle rectal and uterine. The nerve supply. The nerve supply of the ureter is derived from sympathetic nerves, that is from T4, T10 to L1 segments, and parasympathetic from S2 to S4 segments. All these sympathetic and parasympathetic nerves, they carry the pain sensation, and it is because of this fact the pain of the ureteric colic uh, is referred on the medial side of the thigh. So this is all about the kidney and the ureter. Now, the development of the kidney. The kidney develops from the metanephros in sacral region and ascends to the lumbar region. Now, the pronephros, as far as the pronephros and metanephros are concerned, they appear just to disappear. They hardly contribute in the development of kidney. Only a remnant of the mesonephros is the mesonephric duct which persists. The parts of the nephrons are developed from metanephros, and these parts are Bowman's capsule, the proximal convoluted tubules, the loop of Henle, and distal convoluted tubule. The tuft of the capillaries form the glomeruli. The collecting part of the kidney and ureter develops from ureteric bud. This ureteric bud is an outgrowth of the mesonephric duct. So that is all about the kidney and ureter, its visualization by the ultrasound and by the intravenous pylography.